Welcome back to another edition of Ask Dr. George. So I was in a hockey fight over the weekend. I lost my last 2 teeth. What are my options?
Thankfully, that didn't happen.
It didn't happen, but what if it did?
Yeah, well,
what ifs?
What if? So, people come in all the time.
Yes.
And so they are about to lose their teeth or they have lost their teeth.
First, how do we know we're about to lose our teeth? What happens?
Well, they start getting loose or
Okay.
they've worn them all down. They can tell, people kind of have a pretty good idea that their teeth
Okay.
are on their
way out.
So, if they come in and they still have their teeth, that's awesome, because then we're able to manage the situation right from the get-go.
Mm-hmm.
But oftentimes people are coming in, they're already wearing some kind of prosthesis. And so typically what people are wearing is a denture, like this one. Okay?
Mm-hmm.
So just so everybody understands what a denture actually is, okay? Because people have all these different misconceptions. So the teeth on a denture are made in a factory. They're pre-made. There's different molds that the companies have, so they could come in different colors, they come in different shapes and sizes, but they're all basically a bunch of plastic teeth that are pre-made in a factory.
Okay.
And so what happens is the laboratory who's going to actually fabricate the denture, so we send them all the measurements of the jaws, so we take impressions and we send measurements, and then the lab will now fabricate for us something like this.
Okay.
And so basically it's a pink plastic, so we call that a resin, but it's basically a plastic, it's an acrylic resin. And so we set these teeth, these individual plastic teeth are set into this plastic resin base. That's a denture.
Okay.
The important thing to understand about dentures is that you can't, cut away the whole palate because it's just plastic, it'll break.
Right.
So they have to cover the whole roof of their mouth if it's an upper denture. Okay. And in addition to that, these teeth are they're just plastic. So they will wear out in time. They'll grind, they'll wear down. They may chip. People drop them. Connor, you were telling us a story about your grandfather. Tell us about that. What happened?
Yeah, he went to shoot his teeth out, kind of scared me, and they ended up flying right out of his mouth.
That used
Did
to
they
be
end up on the floor or what? Yeah.
That used to be a big thing for senior citizens, was flipping their teeth out at young people. Can you still do it with these?
Oh yeah.
Because if there is a plus side to having dentures, I guess that was it.
It's the party trick. How to scare your grandchildren.
Exactly,
right?
yeah.
So oftentimes, it's funny that you mentioned that, because I do have patients coming in, and they're coming in specifically because their grandchildren were so horrified by the fact that their dentures fell out.
Yes.
That they said they just couldn't handle it, and their grandchildren were like scared of them.
Right.
So they want to come in and they want me to do something to make sure their dentures don't fall down.
Okay.
So in a previous video, we discussed how, over time, the jawbone is going to continue to shrink. Mm-hmm. And so what happens is that with time, your denture gets looser and looser.
Right.
And so what people end up having to do is as you lose this tissue, we call this your pink tissue.
Okay.
So it's your gums and your bone.
Mm-hmm.
And as your bone shrinks and your gums shrink, then we have to add that missing pink that you're losing. We have to add that to your denture.
Right.
So the denture gets thicker and thicker, your gums get shorter and shorter,
Yeah.
and eventually you're not able to function and wear your denture.
Right, and we don't want that.
We don't want that.
No.
So we call that being a dental cripple.
Yeah.
Typically they can't wear their dentures at all.
Okay.
So, at this early stage where they still have a good jawbone, the denture fits them pretty good. After 20 years or 30 years of wearing a denture, they're falling out, they're not able to function anymore at all. Okay. So what we did was we have invented ways of making this denture stay in better.
Okay.
So for that we use dental implants. Mm-hmm. Okay. Some people use glue. They try to use denture adhesives as long as they can to try to stick the denture in, and that works to some degree.
Okay.
But eventually it'll get bad enough that even the denture adhesives won't work. And so that's when they come and see me. And it's important to understand with dentures that, I always say to patients that a denture like this, unsupported by implants, just a denture on its own, is kind of like, losing your right arm and getting the claw.
Okay, the
Okay,
hook.
you're not playing baseball. You're not gonna, it's not the same as having teeth. It's not the same as having, your arm.
Yeah.
This is just the best that we can do. It's an inexpensive way of giving you some function back.
Okay.
So typically people who are wearing a denture cannot chew as hard. They can apply maybe 50 pounds per square inch
Okay.
Of pressure versus with teeth,
What's the normal?
350 to 700.
Ooh.
So like with teeth, I mean, you've seen the strongman videos where the guy's pulling an airplane
Yeah.
with his teeth kind of thing. You can't do that with dentures.
You're not doing the dinky car with those,
Yes.
right?
And so this is the biggest issue, is that their musculature on their face starts to get weaker, more flaccid, and you can kind of tell that they're getting old.
Yeah.
And so it doesn't keep that tightness in the face that you have in your youth.
Nobody wants to get old, doctor.
Yeah, and we're going to lose some of that muscle tone no matter what.
Yeah.
But with dentures, it's accelerated, and the face doesn't look very, very good at all. Mm-hmm. And they'll also lose dimension here. Mm-hmm. So as the bones shrink, the teeth start to move up. You don't see them when they smile. You don't see the teeth. You see this starts to decrease, this distance. Everything starts to fold up. The jawline starts to look very flat, so the face will actually lose volume as well as they start to lose their jawbone.
Dr. George has given you tons of reasons why you should never let this happen.
That's right, yeah. So what we do have is we have different options that people can do to either get rid of their dentures completely,
Okay.
or to have some kind of denture that's attached to implants, which gives it much more stability.
All right.
So, as far as replacement options for people who've lost all their teeth, there are a number of things. So obviously we have dentures. So we have a denture that's just on its own.
Right.
Then we have a denture that's supported by implants. And typically the one that is the loosest is generally the bottom denture. You can see if you compare these two dentures that the bottom one doesn't have the surface area. This is all open. The tongue is sitting in here.
Okay.
So it's a horseshoe. Whereas the top one has all of this surface area here. Okay? So some of the factors that go into success or failure of being able to wear one of these is what kind of jaw bone have you got left? Is there enough volume to hold this in? And depending where they were missing their bone, sometimes people have the bone in the front and they don't have any in the back because they lost their back teeth first and still had their front teeth. And so the denture always wants to flip down when they bite into something. So what seems to be the thing that makes or breaks being able to wear an upper denture is how big their tongue is.
Really?
Yeah.
To hold it all in place.
So somebody who has a large tongue, their tongue is sitting up against the back of this denture, and that's what allows them to bite into things. So, you may meet the odd person who says, oh, I can eat apples, I can eat corn on the cob with my denture.
And you know what's going on there.
Yeah, right? That's why. It's because their tongue is holding that denture in place.
Okay.
And that's what's happening with those people. Now, most of us probably don't have tongues that are big enough to really hold our denture in place. And so, then we struggle.
Oh, okay.
And so for that, we've invented different options. So I'll show you this one here. This is what I would call a clip-on denture.
All right.
So underneath would be 2 implant posts.
That goes in your mouth?
That goes into the jawbone, yeah.
Okay.
And so we place 2 implants or 3 sometimes. And then on the inside of the denture, we have these little attachments, clips.
Okay.
Okay? And the denture clips clip on top of those 2 implants. And then
voila.
they hold it in place.
Okay.
All right. Now the key thing to understand about this is the least expensive way of doing a denture with implants.
Okay.
There's only 2 implants. Something like this, when you chew, you're still chewing on your gums. Okay, because it's not implant supported.
Okay, just being held
in.
down.
So we call that implant retained, but not implant supported.
Okay.
Okay, you're still chewing on the gums. So that's something that's really important to understand. And the other thing is that this is not a rigid connection. You can see here that this still moves. And it has to, because if we tried to rigidly connect to 2 implants, this lever arm here would overload those implants, and then you would lose the implants. So it wouldn't be strong enough. So this is just used to help hold the denture from, when you sneeze, so it doesn't fly out on you.
At your grandkids.
That's right.
Okay.
So that's what the clip-on denture does. But, this is much better than having denture pastes. This certainly will at least leave your denture in place, so when you're eating, it's not flipping around on you, and people can have some function returned with this.
I feel like it would give you a little more confidence too.
Yeah.
Just to know that it's there.
Absolutely.
Okay.
Yeah, this treatment is probably best for people who've been wearing a denture for a long time, who don't mind wearing a denture, but they want it to just stay a little bit better. Instead of glue, we can use something like this.
Yeah, but you have to also make sure that there's enough bone there for you to put that in, right?
So generally we can find enough bone, even on somebody who's as resorbed as this person here on this x-ray, we can find a way to get a couple of implants in here.
Okay.
So, you know, this can be done on most people.
Good to know.
So there's very few people that we can't do this treatment on.
Okay, good.
Okay?
Yeah.
So next step up the ladder is something, it would be still a denture, so I'll show you this one here. This is called a bar over denture. So it's still a denture, it's still removable, okay? Except that in this particular situation, we are now moving to something that's implant supported.
Okay.
Okay, so you're no longer chewing on the gums per se.
All right.
You're now chewing on top of the implants.
Okay.
So that does a couple things. First of all, you can chew harder. You can chew with a lot of force now because you're actually chewing on top of the implants, and the implants are supported by the jawbone.
So would these almost be like real teeth?
As far as function goes, yes.
Okay.
Very similar. You can chew very hard again. And so the reason that we can do that is, in this case here, we would have 4 implants placed.
Okay.
And then we have this superstructure here we call a bar. That's the bar.
Okay.
Okay, and the bar is screwed down into those implants and is not removable.
And that goes right into the gum,
That's
into
right.
the bone.
And
Okay.
I'll show you guys some photographs of that here in a moment, and we'll show you what that actually looks like. All right, so let me show you an actual bar over denture in somebody's mouth so you can understand. So this gentleman here was missing all of his teeth, and so here you can see the tops of the 4 implants that were placed.
Okay.
Okay, and we placed them where he did have some bone. You can see in the middle here it's very thin.
Yep.
And on the sides it's a little bit wider. And then in the back I couldn't put any implants because his sinuses are sitting very, very low. So we put the implants where we found some bone.
Okay.
And so that's what the implants look like here. Now let me show you what the bar looks like once it's installed.
Wow.
Okay, so yeah, so this bar is now installed here. It's not going to come out. And now when the denture goes on top of this, all the chewing force is supported by this bar.
Okay.
So you're not chewing on the gums anymore.
Just
You're chewing on top of this bar. And once the denture goes into place, so this is the denture. Now this is really a key factor here of what we're talking about with a bar over denture. Now this is an upper.
okay.
And so you will notice here that the palate is open. Okay? Which is a big change from something like this, a full denture where the palate is completely closed. And so when we have a closed palate, you know, this alters your ability to taste things. You know, you've got this thing on the roof of your mouth
Yeah.
constantly there. So people who go for a bar over denture on top really enjoy the fact that it's more like having teeth again.
Right.
Right?
Sorry, does this affect your speaking at all? Like when it's over
It
the
can.
top?
People adjust.
But it sounds weird for a bit.
Yeah, when they first get them.
Where this would just be
It's a
full
bit better.
steam ahead.
Yeah,
Yeah.
it's better, yeah, definitely. So that's what the inside of the denture looks like. Oh, I missed this here. I just wanted to show you. These are the clips that clip down on top of that bar.
This is almost making me want to have it. This is so cool.
Yeah, so this is what it looks like when it's in the mouth.
Wow.
So, you know, we can now, you know, the palate is open. They can taste their food better. It's a much better prosthesis for them. And like I said, the chewing is now supported by the bar. And so when you see that inside their, you know, when they smile, I think we have a picture here of his smile. So, you know, it can look very natural.
Holy.
It functions very, very well. The only downside to these is that, remember, you know, we've done some magic, you know, with the foundations.
Okay.
Okay, so we've got implants, we have that bar. This is a very precision type of prosthesis, but it's still a denture.
So it still has to come out
Still has
to be
come out,
cleaned.
and that's a pro and a con.
Yeah.
You know, for some people, it's certainly nice to be able to take it out, clean it, put it back in. That's a lot easier, and I'll show you some other options in a moment here
Okay.
that are more difficult to clean.
All right.
But certainly, this is easy to take care of. You know, if you were elderly, if you were going to be in a home, I would much rather have something like this that you can take out. The nurse can take it out. You can clean it. It's very easy to maintain.
Right.
You know, so that's the pros of this. The cons are it's still a denture. These teeth are going to wear out in time. They're plastic. You could drop it, chip a tooth or something like that. Easy to fix, but also, you know, it's possible to wear down. And the other problem that we see sometimes with these prostheses is that people can chew now so hard that they actually can sometimes break these plastic teeth.
Wow.
Because these plastic teeth were designed to be used without implants. They were designed, when you're biting at 50 pounds per square
Right.
inch. Now you start biting at 350 pounds per square inch, and if you have a chew that's a little off, say you slide your jaw forward and bang into your front teeth, I've seen people actually fracture teeth off of these things because
Wow.
The denture tooth just gets crushed.
That's aggressive.
Yeah, that's how hard they can chew with these. So, but certainly from a functional perspective, this is a very, very nice prosthesis. The other thing that I'll just show you here real quick, you see this metal framework here?
Yeah.
Okay, there's a reason why we have that metal framework in here, and that is that, again, they chew so hard that people can break these dentures in half. So that's the main difference, is that when you have one of these implant supported overdentures like this with the bar, people are chewing very, very hard again because it's implant supported. And so they can actually crack the denture. So to prevent that, we make a metal framework inside this denture, which is going to help give it the strength that they need to be able to withstand the new chewing forces that they're going to be applying.
Right.
And of course, that will help support, your facial musculature because you can eat again. So a bar over denture, this is the Cadillac of dentures.
Okay.
I really love bar over dentures. They're moderately affordable compared to other options. They're more expensive than the clip-on denture that I showed you a moment ago.
But would you rather someone spend that money now and do this now than have the other problems we've talked about later?
Yeah, bar over dentures can be done at most stages of bone resorption.
Okay.
Not all stages, like at the end game where there's no bone, it's very difficult to do a bar over denture.
Okay.
But bar over dentures were designed specifically for people who were already edentulous and not able to function anymore.
Okay.
So we still have this option available for people who've lost even a lot of bone, who've been wearing dentures for a very long time. So, a bar over denture is still a very, very good option. It's one of the best options, actually. Okay. And I like the fact that people can remove it, clean it, put it back in. That's an issue that we have with some of the more advanced treatment plans that we have, like when we get into fixed teeth. When they're not able to remove them, they're a little bit more difficult to keep clean.
Okay.
Okay, so let me show you some of the remaining options. So we've talked about a clip-on denture.
Yep.
We've talked about just a standard denture, and now we've talked about a bar over denture.
Okay.
So those are the denture options. Okay. Now let's talk about fixed teeth.
All right.
For a moment. So there are options where we can do fixed teeth, and so there's two options for what the teeth are made of. So when we start talking about fixed teeth, we're talking about something that's not removable at all. So it's screwed into place. The patient cannot remove it. The dentist can, sometimes. It depends on it depends on how we've constructed it.
Okay.
But sometimes they're retrievable, then they're removable, and sometimes they're not. And so these are wonderful options. But like I was saying, there's two materials we can make them out of. We can make a fixed denture, so where we're screwing a denture down, so sort of like the bar. And then we can also do a fixed porcelain bridge.
Right.
And so, and there's advantages and disadvantages to both of those treatments. So I'll show you guys very quickly here those two options, and then I'll probably do another video just on fixed teeth.
Right.
Because there's some very important details, and I don't want to drag this video out and make it into a 20-minute long video. Right. So let's talk about fixed teeth options for a moment. This would be like a fixed denture.
Okay.
In this case, we've got 6 implants underneath of this, and this is still a denture. So it's plastic teeth, pink resin base, and then this is screwed down on top. Generally, there would be holes through these teeth here, and we would screw this down into place.
And it would stay.
And it would stay.
Okay.
So this would be something for somebody who has had a lot of bone loss, right? So when they've had a lot of bone loss, the teeth still need to be in a position where you can see them. So when you smile, you still want to see the teeth. So that's how we know where the teeth are in space.
Okay.
And then we have to, of course, go from the position of where the teeth are all the way up to where the gums are.
Right.
So in this case, this is a type 3 restoration where we have pink on it, okay? To replace the pink you lost.
Okay.
And so this would be fixed into place, not removable. But the problem is how do we keep this area clean?
Okay, right.
Okay, so we've got this edge here. Food likes to accumulate on that edge. Sometimes there's gaps, like you can see that on the inside here. You zoom in a little bit here, you can see that there's like a ledge.
She would
on
get
the inside of
plaque
that.
and all kinds of
They
things
get
back in
plaque,
there.
they get, you know, food getting caught on this area here, and it sometimes can be very difficult to keep it clean.
Yeah.
Which is why I said, you know, for somebody who's in this type of restoration where they've lost bone, I don't like these very much.
Okay.
I think it's better to be able to take your teeth out and clean them
Clean it up.
and put them back, you know, than to have them fixed into place like this and be very difficult to keep clean.
Absolutely.
So for me, this type of restoration, a fixed denture, I'm not a huge fan. We do them. Some people want to have their teeth fixed into place, you know, but it's not my favorite. Now, let's contrast that to a fixed porcelain bridge. So this is a fixed porcelain bridge. So
Is this what all the big stars have in their face right now?
if they don't have teeth, then they
Yeah,
may have
okay.
something like this.
Okay.
So you can see when you compare these two devices here, these are totally different
Yeah.
kinds of devices. Okay, so first thing you notice is there is no pink on this.
No.
Okay, this is just teeth. Okay, so typically we can only do something like this when the person has just lost their teeth.
Okay.
Okay, so they've got full bone because they haven't lost that height yet. So we can do a fixed bridge here like this one. And so, you know, you can see that that will look quite nice.
It does look
when
good.
you get that in their mouth. And this is made totally differently than this.
Okay.
Because I described to you earlier how a denture's made. It's individual plastic teeth and they're held together by this pink resin base. Okay? With a bridge, there is no resin base. So this porcelain bridge is actually milled out of a solid block of porcelain and the teeth are all joined together. So this is not, you know, individual plastic teeth that are somehow glued together. This is a one-piece porcelain bridge.
Wow.
Okay? And then that can be screwed into place. Now something like this is actually very easy to keep clean. There are no ledges here. You know, this is just like having teeth again.
Yeah, because they kind of scoot right up where the roots would go and the whole
Exactly,
deal.
right? So all you have to do with this is just brush and sometimes maybe use a water pick or some device to massage the gums and clean around it. But there really are no spaces
No.
that are going to collect a lot of food on something like this.
Right.
So this is an excellent way of replacing your teeth if you're just about to lose them.
Okay.
So for somebody losing their teeth, we can do something like this.
Or if there's an accident, something happens that you've lost some teeth or whatever,
Yep.
boom,
You
they're
have
back.
something like this.
Okay.
And this can be done as, you know, if just one section of missing teeth, can be done with just one tooth,
Okay.
or it can be the whole thing.
Okay.
So, you know, those are our options. So, you know, just to review again real quickly, we can do a standard denture. We can do a clip-on denture with a couple of posts, you know, that just to help hold that denture so it doesn't fall out. We can do the bar-over denture, which is the Cadillac.
Highly recommended.
Yeah, for people already wearing dentures, this is the best one. And then for people who are losing their teeth, we can do a fixed bridge. So this is really the nicest thing that you could do. No dentures, nothing is being removed.
Yeah.
Easy to clean, easy to maintain. This is an excellent procedure. And then my least favorite, the fixed denture.
You'll do, but you don't really like to.
Not my favorite.
Okay.
You know, some people love them, you know, and that lady that I showed you the bone loss x-ray on, she had that done.
Okay.
Okay, so we'll do another video and I'll show you a little bit more detail about each one of these options.
Awesome.
Thank you.